This article at the Times is a great summary of what we know about the effects of sleep on behavior, and particularly in kids. The long-term consequences, though, of kids getting wired instead of tired, for instance, with either sleep deprivation or problems with breathing at night, are really unknown. We know that ADHD turns out to be ADHD in adults. So the diagnosis and the tendency to be hyperactive follows kids from childhood into adulthood. And if the real reason for their overactivity, their problems focusing, their behavioral problems in childhood is sleep disordered breathing, it's a real tragedy, because those kids' brains are developing. An area deep in the brain called the hypothalamus is developing. The kinds of neurotransmitters and pro-inflammatory kind of chemicals that the body uses to marshal the soldiers of the immune system are elevated in these kids. And they continue on to change the hypothalamus, or the very deep structures in the brain, as the kids develop into adulthood. Whether these problems that kids have roll over into adulthood, into diagnoses like ADHD in adulthood, problems focusing, problems with performance, or even bipolar disorder. We don't know, but the studies are being done and need to be done. So it's really important to fix these sleep-related breathing problems in kids. Of course, the first thing you think about is tonsillectomy and adenoidectomy. It's appropriate as a first-line treatment for kids with big tonsils, big adenoids. But sometimes these kids need the same therapy that adults need, namely CPAP, positive airway pressure, to open their airways at night so they can breathe. Some tip-offs for sleep disordered breathing would be a kid who's a noisy breather, a kid who tosses and turns in his sleep, a mouth breather, snoring, particularly in kids. Snoring's common in adults, but it's not normal. It's never normal. It's always a sign that a person is having problems getting air through the upper airway. Side sleeping, sleeping on the tummy. All these are indications that the body is not getting enough air at night, so it's forcing a person to sleep on the side or the tummy in order to get the tongue out of the way. Kids can be tolerant of CPAP just like adults. They have to be educated. And the beauty of this disorder is, the sleep-related breathing disorder is, it can be fixed. And it can be treated and lives improved if the disorder is recognized. So you need to be aware of this as parents, because 99% of your pediatricians are not going to be tuned to this. They're going to be trying to get through their day, just trying to see the patients, just trying to get the sore throat patients and the asthma patients and all the things that go wrong with kids through the day. They aren't going to be tuned to maximum performance for your child. You're the only one who can be an advocate for your child.